Hello, everyone. Today I want to share with you a situation where, let's say, a patient coming to you with partial denture, and they require a filling or a crown. And he tells them, I'm going to do the filling. There's a chance the denture might not fit really well after the filling, and you'll have to go back to the denture clinic to get it adjusted or something, or I'll do the best I can to make your filling fit or your crown fit. You send the denture to the lab to fit it to the crown, and you bring the patient back. The denture doesn't fit well. You keep adjusting and adjusting, it doesn't fit well. Then the patient leaves the practice not happy with you and want to put a complaint or want a refund, or they want you even to pay for a new dentist. And I have tried many different methods over the years. Maybe you have something better than me, but I want to share with you something so you don't repeat all my mistakes that I've done and give you a system that will work 99.9% in every situation. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my dental practice, Lakeside Dental Spa in Harvey in Queensland. And I took it from one chair to 10 chairs, from 3 staff members to close to 40 staff members over the course of 15 years. And you can check my details below for credibility. So let's start with fillings and then talk about crowns after. So let's say patient has a removable partial denture. That's one scenario, or even a sleep apnea appliance where they pay $2,000 for it, and now they require a filling. Could be a class 4 filling or a 5, 6 surface filling on one of the back teeth. And you want to make sure this denture or this sleep apnea appliance fit really well around this tooth. So, first situation, the tooth is intact. So let's say the premolar filling is there and there is recurrent decay. What I would do, I will take an impression with a clear PVS material, so like a clear bite material. So in the tray, I will put some foil there, so the impression material doesn't go into the holes of the tray. Take the impression, then take this out to become like a stent. I will drill to find where the curve is. Let's say you have to remove the whole filling, clean the decay, etch bond as usual. I will fill the tooth up, but underfill it without the last layer. And then on the neighboring teeth, I will put some Teflon. Then in the index, I will put something like genial flow or a heated composite. Place the tray, seal it really well, cure, then remove it and finish all the excess. You'll need a lot of finishing burrs, of course, and a lot of finishing strips, but you capture the exact same size of the tooth that was before, um, when the denture used to fit on it. So that's scenario number one. Scenario number two, the tooth is broken down. So there is no, you cannot take an index. So in that case, again, clean the decay, etch, bond, fill up your tooth, but under filling, except the last layer, make sure your denture or your sleep apnea appliance fits really well. And then for the last layer, again, put Teflon on the neighboring teeth, make it nice and thin. Put your last layer of composite, put either Teflon on it or cling wrap, very thin plastic cling wrap. Then seat your partial denture up and down a few times and cure while it's in. Although it's metal, but just cure around it. And then remove it and cure more and finish the excess. Your denture or your sleep apnea appliance should fit perfectly without any adjustment on the appliance. So those are the two ways I will do with fillings. Now, when it comes to crowns, sending the denture or the sleep apnea appliance to the lab doesn't do anything really, because to do that you need accurate models. If the denture is sitting on a free end saddle, for example, with soft tissues and there is border molding what's happening, your crown and bridge impression or scan should be perfect so they can see the denture. But you never, it's very hard to get it accurately. The best scenario, the best thing to do, let's say again, the tooth is not broken down, there is recurrent decay or something, or there's a crack. So you can match the size of the tooth. I would scan, or if you don't have a scanner, take a PVS accurate impression with heavy and light, not with body, heavy and light, and accurate impression, and use this scan or this initial bite to ask the lab to mill a zirconia crown exactly the same preoperative size. The lab should be able to mill a crown that will match the exact size, and this should fit perfectly under your denture or under your sleep apnea appliance. If you have a CEREC machine can match that size perfectly. And I've done this many, many times. If the tooth is broken down, I'll put a big chunk of composite there, Then I will seat my appliance many times after put like a cling wrap or Vaseline even on top of it. Make sure the appliance is fitting really well. Take it out, cure, then finish it so there's nothing on the proximal teeth or there is no overhangs. Seat your appliance again, make sure it seats really well. And now that is your preoperative tooth. Again, you can scan that or you can take an accurate PVS impression. Not putty, talking accurate as heavy and light because you want to capture all the fine details on the tooth. By doing that, your crown will always fit really well under your appliance. All those techniques I've used for many times, and it never failed me because I do a lot of sleep apnea appliances, and sometimes you do the appliance, the patient come back a year or two later requiring a crown or something, and this technique never failed me. So again, if you don't have a scanner, it has to be a heavy and light, accurate impression with no direct lines, no voids, no air bubbles, and you'll use this to make your temporary crown as well, of course. One more thing, always under promise and over deliver in dentistry. So even if I'm doing that, I'm confident it's going to be fitting, I don't tell the patient it's going to be perfect. I tell them, I will do the best I can to make this, it can be very hard, but I'll do the best I can to make this fit under your denture or appliance. But be aware, there's a small chance you might need to see like the denture clinic or I will send the denture or send the appliance back to the factory to get it or to the lab to get it adjusted, and there is an extra fee. It's not your fault. It's an extra fee that the patient has to pay. Or there is even a small slim chance that you might have to pay for a new appliance. Again, it's not your fault that the teeth are getting decay or getting problems under those appliances. Your job is to fix their problems, not to own their problems. Have those two in writing, then you put your crown, you put your filling, it fits perfectly, patients will be very extremely happy. Doesn't fit perfectly, the patient already consented and agreed in writing that there are fees to repair or there is even a fees to remake. By having those strict policies in place and this strict system of managing those patients, you'll always be a very happy and relaxed dentist, and your patients will be always very happy with your service. Thank you so much for listening to me, and if you find this information helpful, make sure you like it and share it with your friends and colleagues, and please subscribe to my channel so you are notified when more videos are released.